Right, I can confirm the webcast has started, so please begin.
Thank you, Marie. Right, Peter, shall we go straight to you about demand management and prevention?
Thank you. Yes, so the paper today in terms of demand management prevention is in relation to grant awards. The recommendations are to award a grant totaling 20,000 to Age Concerned Hampshire to cover a period of a year from the 1st of April 22 to the 31st of March 2023 as part of our Rural Connections grant. To award a grant totaling £60,000 to Good Neighbours to cover a 12-month period between the 1st of April 2022 and 31st of March 2023 as part of our Neighbourhood Care and Support grant. And finally, to seek approval for the closure of the Autism Support grant from the 1st of April 2022. In terms of the two grants, in terms of the grants, as you know, demand management has been utilising grants up to this point to award grants to voluntary sector organisations to deliver services which then seek to reduce demand on our social care services. In terms of these two grants, the Rural Connections grant is to enable recipients to receive a service that develops and supports local volunteers in rural and semi-rural settings to provide information and advice for vulnerable adults in their communities and facilitate connections with other services and assets, such as community assets and buildings, basically services in their community which they might benefit from and reduce issues such as social isolation and loneliness. That's the Rural Connections grant, and that's what we're seeking for, as we say, funding to Age Concerned Hampshire to deliver that service as part of their community information service, which was formerly known until last year as the Village Agent Service. Yeah. The second element, obviously, is for the Neighbourhood Care and Support grant, which is to enable an organisation to provide support to a network of smaller local organisations underneath but not separate to that organisation, whose purpose is to support vulnerable adults in their community. So the role of this organisation is awarded the grant is to support and develop those neighbourhood level groups, as well as helping provide safe, sustainable support, which enables them in turn to provide safe, sustainable support to vulnerable individuals, and particularly assisting older adults and those who are, again, lonely and socially isolated. The Good Neighbours Network itself, the organisation, support over 118 neighbourhood level groups with assistance with activities such as befriending and transport assistance. And they have still continued to play that role within COVID, although that has changed our activities somewhat. Previously, that grant has been awarded over a 24-month to a year period, but this period has been decreased for 12 months for this award. But the amount remains the same as the amount we awarded in the last 12 months of the year in that 2-year period. And finally, the Autism Support grant has been previously awarded since March 2017 to fund services to support people with autism and their families before, during, after diagnosis. However, recently, national guidance has changed on autism and how the Care Act should be applied for people with autism, which has strengthened the case for an information, advice and guidance service to be provided to adults and their families about what services and support they can access. As a result, the County Council has moved across from delivering the service as a grant, which was fully funded, towards making this a contracted service. And that contracted service is due to begin on the 1st of April for a period of up to 3 years. The awardee of that contract is actually the same as the current grant recipients. There will be no change in service provider for them, and actually the terms of that contract are very similar to the previous grant. Should be a smooth transition for not just our organisation, because there's no change in organisation, but more importantly for those residents, their families and their carers. As a result of that change to that contract, we're then ceasing the grant because it's no longer required, because it's now a contracted service. The two grants themselves, which we are looking for in the paper, total 80,000 as is clear, and that payment is within our existing budget agreed envelope for these grants. And finally, all the organisations who are seeking award will be signing a declaration that stating that they accept the grant funding can only be awarded for the given period, and no commitment exists from the County Council to continue funding after this time or in subsequent years.
Right, thank you, Peter. Can I just ask about the age concern one? Because we had the village agents going back, what, 8, 9 years now? And
Yes.
they've become rural connectors. And we've been giving them grants all that time, because I actually think the village agents were our idea in the first place. Is there any scope for turning them into a commissioned service for us, or are we concerned that it might not carry on?
Currently, there's always that scope, and it also depends on what the impact. It's a bit like it's happened to the autism service. It depends on whether on the Care Act guidance and how that links to our priorities in terms of meeting our needs and our duties underneath that under the Care Act. But equally, it also depends on the impact of that service in terms of it being able to demonstrate the ability to meet the needs of the people they're looking to work with, so that if there was a demonstrable impact, then maybe we feel the need to then make it into a fully contracted service. Further to that, before Graham comes in, I'm sure with further comment, is also we part fund the service, we don't wholly fund the service.
Right.
Whereas when it's on the whole, that's a contribution towards the cost rather than the full payment for the service in its entirety.
Thank you. I will bring Graham in. I mean, I know previously we had some really good village agents who went above and beyond, and there were other areas where we weren't hitting the right people. So, yeah, sorry, Graham, you come in.
Yeah, I just wanted to, I guess, add a little bit to what Pete's already said. So there is something for us, which is looking essentially at that business case to the value of these services as we go forward. What I can't do though is divorce these grants from intended SP23 savings, which will be subject to stage 2 consultation in due course. There's nothing to prevent these services continuing, but we would need to find savings of equivalent value to those within our SP23 proposals to enable us to continue funding levels. And that's where that kind of value stroke business case would need to come in. But certainly some of the conversations will be on the basis that we are part funding some of these services, is whether some of those other contributors could increase their funding, or indeed we find other funding routes by which services could continue. So that's essentially where we are at the moment. We'll continue to work honourably in that space as we go forward.
Okay, thank you. Councillor Withers, have you any questions or queries?
No, I think Graham's just explained a very sound situation there. And therefore, I think at the present time, I endorse the recommendation.
Thank you. Councillor Briggs.
Thank you. I will also echo Councillor Withers' remarks, and to Peter, I won't give him any more headaches about the Good Neighbours scheme. He will be delighted. Thank you.
Thank you. Okay, well, thank you very much, Peter. Happy to approve that. And we move on now to Dave, is it? Yes.
Good afternoon, Councillor Firth. As we have just gone through a thorough presentation and discussion at HASC, the Select Committee this morning, in respect of both items, item 2 and item 3, the revenue budget and the capital programme, I'm not proposing to go through in any more great detail here, if that's okay with yourself.
Absolutely fine. Yeah. So
in which case I would just direct you to the recommendations on the first page of each report to approve for submission to the Leader and Cabinet the revised revenue budget for 21-22, summary revenue budget for 22-23, and the proposed fees and charges as set out in Appendix 2 for adult social care, that last point. I'll just take those 3 recommendations first, if that's okay.
Fine. I mean, I'll just ask Councillor Withers and Councillor Briggs if they've got anything to add, and if not, then we'll go to the approvals. Okay, Councillor Withers.
No, nothing to add, Chair. Fully endorse.
Thank you, Councillor Briggs.
Yes, fully endorsed, nothing to add.
Okay, Graham's going to come in now and object.
No, not at all. It's just for completeness, just to say that a select committee this morning, clearly in terms of the recommendations within the select report, was subject to a vote, but for both the revenue and also the capital budget, they were carried by majority, but just for completeness to say that it wasn't unanimous, but there was a clear majority in favour of the recommendations before you.
Thank you, Graham.
In addition, there is a recommendation on paragraph 5 of the revenue report, seeking for approval to delegate to the Director of Adult Health and Care, in consultation with the Executive Member for Adult Services and Public Health, to undertake all activity or all required activity to allocate and disperse funds, including the awarding of grants from funding made available by the government to support the County Council's ongoing public health and adult social care response to the COVID-19 pandemic, as outlined in paragraph 40.
Yeah, very
Just
happy to approve that as well. Okay, so thank you, Dave. And do you want to carry on?
I would just say, obviously, there are slightly different recommendations in respect to the capital report, which is item 3.
Yeah.
I'll happily read those. They were to both. There's 2 recommendations. Again, it's to approve for submission to Leader and Cabinet the capital programme for 22-23 to 24-25. And the second recommendation is a specific one to recommend to Cabinet that environment to culture, communities and business services revenue budget of 1.03 million to fund health and safety works within the nursing and residential estate, as set out in paragraph 18 and 19, is approved.
Absolutely. Councillor Withers?
Yes, there was a unanimous vote to approve that recommendation, and it was justified.
Yeah. Councillor Briggs?
I'm happy with the
Yeah.
recommendation.
Right, Dave, thank you very much.
Thank you very much.
Yeah. Right. Do we have an outside bodies thing? Yes. Who's doing that?
Councillor Fairhurst, given that it's a decision that sits with you, there is an item 4 report in terms of nominations. I think it's the Keeley Diamond, who's currently studying public services at Basingstoke College of Technology, be the young people or the young persons representative on the Hampshire Hospitals NHS Foundation Trust governor. Also there that we've got Councillor Juliet Henderson to be the HCC appointed governor again on Hampshire Hospitals NHS Foundation Trust for the term of her appointment, which is until May 2025. Thirdly, the Jill Duncan continues again on the Hampshire Hospitals NHS Foundation Trust as the older people's champion until the end of her term in September of 2024. And finally, that Councillor David Leakes from Basingstoke and Dean Borough Council again sits on the NHS Foundation Trust for Hampshire Hospitals as the champion for people with a disability until his term ends on the 31st of March 2022. That's when his term as office is up, and you'll need to reconsider then in due course an appointment to that role.
Thank you, Graham. Have any of the opposition parties put forward or nominated people as apparently they are now entitled to do? Have we had any other nominations, Marie, from any of them?
No, so I consulted them as per the new process to let them know that this appointment was coming up. So they had the opportunity to put forward a nomination of an alternative proposal, but I didn't receive any feedback on this occasion.
Thank you. Councillor Leake, whose nomination is up in March 2022, can he, if he's willing, be reappointed, or do we have to seek a new person?
No, so he's done 3 terms, I think now, which is the maximum he can do. Yeah. So it would need to be a new appointment for that one. So we will be looking to start the process imminently to seek a replacement for that, which will come to your next decision day.
Good. How do you go about finding someone, Marie? Do we go to the
I'll
Hampshire
defer that
Learning
one to Graham,
Disability-
I think.
Oh, okay, Graham.
Yeah, Councillor Fairhurst, with your agreement, what I would suggest is we've got a number of co-production networks that we work with. Clearly, we've got people that use services, including people with a range of different disabilities. I could certainly, through those co-production channels, put a request out for any nominations to be made known, and then subject to your determination, you could seek to appoint.
Yeah, no, that sounds good. Right, fine. Okay, and happy to approve. This is the younger person we're getting on the board, isn't it?
Yes, on this
Yeah.
occasion. So this is the young
Yeah.
person's champion. Yeah, so that's Keely Diamond.
And she will serve 3 years?
She will serve up until July 2024, when technically her course finishes at Basingstoke College. So she's got two and a bit years.
Okay, thank you all very much. Thank you. Is that it? Are we finished? We are. Okay.
Yeah, that's it.
Thank
Thank
you
you.
all.
If that one's approved, I'll
Yes.
finish the webcast. Thank you.
Good.